had a shoulder injury about a year ago or longer. There was no clear indication as to what the injury was caused by. I had some tense muscles in my shoulder and my back, and one day I woke up and I couldn't raise my arm anymore. My name is Anthony Verone. I'm a patient of Dr. Elkwood's. So we had MRIs, MRNs, and EMG studies done to reach a conclusion to do brachial plexus surgery.
So brachial plexus surgery, or other types of nerve surgery, is done for many reasons. The most obvious reason is for paralysis, people that can't move. Other reasons are feeling in the hand or leg is very important, helps avoid injury, helps know where your hand is in space and for coordination. And lastly, the other reason to operate on these types of nerves are for chronic pain.
Pretty much I needed to come to a conclusion as to get the surgery or as to just let it heal on its own and see if that would work. So time was kind of running short and healing was going very slowly. As far as the EMG tests show.
Timing is very important when it comes to these injuries. If a muscle does not have nerve input for a year and a half or so, it will irretrievably atrophy. When you fix a nerve will heal at about 1 inch a month. So it's a lot like when a plumber fixes a pipe, you have to wait 10 seconds or so to see if the water comes through the pipe. For a nerve, it's not 10 seconds, it's about 1 inch a month. So if you want movement in the forearm, which for the most part is what moves the muscles, the fingers and so on in the hand, and if you fix it up here, it's got to go all this distance, so you consider just from the repair, that will take about a year. And that clock is still ticking. So you want to get to these issues as early as possible.
I decided to get the surgery done so I could save my job essentially and return to work sooner than later, and I made the right choice. I'm now pretty healthy and able to do everything I was unable to do for a year. The surgery was in May. I've been doing physical therapy 3 times a week until I return to work. Now I just go once a week and I feel much better. It's amazing the results that have been provided by Dr. Elkwood.
As you can see with brachial plexus injuries, some patients do exceptionally well. And here you see videos of a patient that's able to do push-ups again. So it's not just a question of movement, it's also a question of strength. Overall, the important thing is to get to these patients as early as possible. That is balanced by the fact that many of these weaknesses or paralyses will get better on their own. So it really takes an expert to decide about timing. The one thing you don't want to do is wait too long.